Welcome back to PT Time with Tim. I'm Dr. Tim, a licensed physical therapist, and I'm here to provide you with the best physical therapy exercises and stretches to treat and prevent common injuries. IT band syndrome is an overuse injury of the IT band that causes pain and inflammation in that IT band. It's caused by repetitive activities. Most commonly, we see this in runners, endurance athletes. I've seen it in patients that just have walked up and down hills around their neighborhood too much, going up and down a bunch of flight of stairs. If you say it's moving day at your apartment or you're helping somebody move into your apartment, that'll get you. I've definitely seen that one plenty of times. Or if you're doing some kind of exercise class, doing a lot of squats. So those are the common activities that really can flare the IT band up. The IT band runs from the outside of your pelvis and inserts just below your knee. Because IT band syndrome is an overuse injury, the very first step in treating this condition is to stop doing the aggravating activities. You've got to stop doing whatever is aggravating that IT band in order to allow the healing process to begin. The second thing that you should do is start using ice in the area because it is an inflammatory issue, so ice is going to help decrease that inflammation. Okay, so our first exercise with IT band syndrome is to use a foam roller. The repetitive use of that IT band that causes the pain and inflammation is also going to cause that thing to really tighten up on you. So you're going to notice that IT band is very tight and tender, and we need to get that to relax to help promote the healing process, to help reduce those kind of adhesions in there. So basically, if you get a foam roller, lie on your side with the painful side down, bring your other foot in front of you so you're off weighting your body through the foot, the hip, and your forearm. You can even use your other hand, because in the beginning you're going to notice this can be very painful for people that are not used to this. I am very used to this, so even I'll go right up into the advanced position. But for those just starting out, just start with the foot and the forearm and the other hand down. You want to be on the very outside of the thigh, so my left foot is pointing straight forward. Starting just below your hip bone, so if you know that hip bone that you feel out here, don't go over the bone, start below it, and you'll start to roll down towards your knee. So I'm going to slowly start to walk myself down towards my knee. Now, if I have a lot of pain, as I get closer to the knee, I'm not going to go that far. So don't go all the way down to where you get this like sharp stabbing pain. So you want to stop well before that. You just want to find that area that you can tolerate, slowly go back and forth, because basically what you're doing is you're massaging out that IT band, and what you'll notice is you're going to hit some bumps in there. You're going to hit some knots, and I refer to them as speed bumps, because really they're like these painful bumps that you kind of roll over, and it feels like you're going over a speed bump. And so those are what you want to really work out, because those are those tight areas. And so just kind of slowly go back and forth up and down that IT band in that tolerable range, and do that for 3 to 5 minutes if you can. Our next stretch is a hip flexor Tomaz stretch. So for this stretch, I usually tell people to either lie on the edge of their bed or their couch, so wherever they can touch the floor with their bottom foot. So you'll lie on your back with your leg off the table, but you got to make sure that it's in line in a straight line there, because you don't want it kicking out to the side. You won't get nearly as good of a stretch there. So make sure that you're in that straight line. You're going to put your bottom toes against the floor, so you bend your knee up as far as you can. And then if you already feel a stretch in that front hip flexor thigh area, so the front of the thigh, then you're already good. You can just stay there. You want to look for a moderate stretch intensity, and then we'll hold that for 1 minute. Now, if you don't feel a stretch here, then you can grab the opposite knee and pull that knee in towards your chest, which is going to bring this side of the pelvis up, increasing the stretch on the down leg. So again, this is kind of the advanced position here, and you would hold for a minute. Now, either way, you're going to do 2 repetitions of 1 minute hold. So again, you can either go from the basic position where this knee is just kind of resting, pointed straight up, or you can go to the advanced position. Our next exercise is a side-lying hip abduction exercise. So this one is going to work the outer glutes, your hip abductors, which are right where my hand are. So for this exercise, you'll start with the bottom leg bent, the top leg straight, and the toes pointed straight forward. Now, you can't see it that well from the camera angle, but I have my leg straight in line with my body. I'm going to bring this top hand to my hip, and I'm going to lift my leg up so that, again, my toes are still pointed straight forward, and I'm feeling the squeeze on my outer hip. So I'd lower my leg back down, and I lift back up for 3 sets of 10. Now, the two cheats that you're going to see is that your body, especially when you're weak in these muscles, your body's going to want to roll your hips back. So make sure that you don't roll the hips back. And the second cheat is that you're going to point your toes towards the ceiling, because that kicks in the hip flexor. And most people are much stronger in their hip flexors, which are in the front of the hip, but we don't want to do that. So make sure the hips are perpendicular to the floor, and when you lift the leg up, the toes stay straight forward. Now, if you happen to think this one is too easy, which I have a feeling that most people won't think that, but just in case, if you want the advanced position, you'll come up into a modified side plank. So I bring my forearm underneath me, I raise up on my bent knee, and then I do it from there. So this one is definitely a lot harder because you're working both hips together. So this side's stabilizing while this side's moving. But if you just have a desire to challenge yourself, you can certainly go to this more advanced position for 3 sets of 10. All right, so our next exercise is a sideline clamshell. Sideline clamshells work the hip abductors and external rotators. So you're going to feel more of the fatigue and kind of muscle burn in the back outer part of the hip. So for this exercise, you're going to lie on your side with both knees bent and stacked, hand on your hip, and keep your feet together while you raise the top knee up, opening up like a clamshell towards the ceiling. However, you got to make sure that you're keeping the hips perpendicular to the floor, because as you lift up, you're going to want to roll back, which makes it way easier, but that's a big cheat because you're not going to get nearly as much benefit out of it. So prevent that hip rocking as you lift up. You'll feel that you really have to squeeze those glutes on the top side as you open up. And you'll do that for 3 sets of 10, even 3 sets of 15, totally fine. Just depends. You want to get some good work out of it. You want to feel some of that fatigue in the hip. Now, if this one is just way too basic for you, you can, just like the last one, you can go up into a modified side plank position so that you're coming out of that plank where both sides are working at the same time for the same 3 sets of 10 to 3 sets of 15. Our next exercise is bridging, and bridging works mostly the hip extensors, so the glute max in the back here. You'll lie on your back with both knees bent, your arms down to your sides. I always find it easiest if I pull my toes up, because if you push down through your heels, you're going to get more squeeze in the glutes, rather than if you have your toes down, you tend to use your calf muscles more. So try it with the toes up and see if you get a better squeeze there. But basically, you're going to raise the hips up and as you squeeze the buttocks together. Pause at the top and then back down. You're going to do that 3 sets of 10. Now, if this one is just way too easy for you, then you can go to a single leg bridge. So you have your knee, your opposite knee pointed straight up to the ceiling. And so focusing and isolating just one side at a time for 3 sets of 10. All right, so our next exercise is a tandem stance sit to stand. So basically, you want a firmer kind of chair, so I took our dining room chair here, push it up against something so that it's not going to slide on you, and then you'll stand in front of it in a tandem stance. So I'm going to offset my feet, and depending on how challenging you want this to be, the further you offset the feet, the harder it'll be, the more weight it's going to put on one leg. If you need it a little bit easier, then you bring your feet a little bit closer together. So you can just play around with that and find that adequate kind of position for you. But basically, I'm going to have my working leg back and my other leg forward, cross my arms, and then I'm going to sit back, controlled, into the chair, lean forward, stand back up, Now you're trying to take momentum out of this, because if you use momentum, if you really kind of get your weight going, you're not going to feel a lot of work with this one. So really try that slow and control. So I'm feeling a lot of work on this side with this one, that back leg. So kind of slow sit and then drive through that heel back up. And you'll try this for probably 2 sets of 10, but really working up to 3 sets of 10. Thanks for stopping by PT Time with Tim. You'll definitely want to go check out my best knee strengthening exercises video next as you continue to advance on your pathway to living a pain-free, active, and adventurous lifestyle.